So this short video is intended to be a brief summary of some of the concepts we talked about in phase one on week one, specifically about the wives in the program whose husbands may have a sexual addiction. Where is the partner during all of this and all of the commotion and emotions that are flying all over the place? Where is she? And I think it's important for the husband to understand it, and certainly for the woman, the wife, to understand where she's at and what's going on so that you don't feel crazy. Many wives have described to me that they actually feel like they're going crazy. But in essence, what most women are experiencing is what we call betrayal trauma. It happens when a husband or a committed partner secretly turns outside of that relationship to something or someone else to satisfy his sexual urges. And that kind of trauma may shatter his partner's inner world. She starts to question who she can trust, who will be there for her. Is there something wrong with her? And her whole sense of identity is destabilized and destroyed. It's a little bit different than most addictions, where if the husband has an alcohol problem or a drug problem, most women will not internalize that. It's easier to recognize that it's not about them, but there's something about the nature of sexual addiction that causes a woman to question herself, and it becomes much more traumatizing in essence. So be a bit careful, because if you realize that a woman may be experiencing trauma, and you turn around and tell her that she should stop being so codependent, you actually undermine healing that needs to occur. If a woman is feeling insecure about herself, if she's feeling panicked, she's worried about her husband's behavior, it may very well be because she's having a trauma response, not because she's codependent on her husband's behavior. So, for the human condition, trauma is trauma. And it doesn't matter whether you are a Vietnam vet, a victim of childhood abuse, or you've had betrayal trauma in a relationship. The physical symptoms are very similar in any form of trauma. You might have intense fear or anxiety that overcomes you, panic, a feeling of out of control. You might have outbursts of anger or rage, a deep sense of depression or sadness, emotional flooding, which means it just comes over you and you just feel like you're drowning in it, worrying excessively, or ruminating, which basically means to dwell on the thoughts. You keep repeating them over and over and over. You may have intrusive thoughts of the trauma, so it keeps popping into your head what happened or what might have happened. Difficult to concentrate, remember things. You might start losing your own self-care, personal hygiene. You might have an overwhelming sense of helplessness, sleep difficulties, difficulty eating. You might regress to old behaviors you had, coping mechanisms with drugs or alcohol or eating disorders or things of that nature, all as a result of symptoms here of trauma. So a trauma response then will generate what we would call a fear cycle. And in the center of this fear cycle would be just very simply fear. And you might experience it as anxiety or panic, that sort of thing. But the fear that comes up then starts to bounce around like popcorn, and it will cause you to sometimes start obsessing over what happened or what might happen or what could happen, but then your fear keeps coming up, and so you're trying to control the obsession, and then you start to control things, and so you bounce over there, which might be overly restrictive in different ways. You might try and control his behavior, have him followed, check his emails, things like that, and then you go right back to obsessing about it, and it becomes this just overwhelming cycle. And so the fear cycle then leads itself into unhealthy reactions that many experience. It might include things like unhealthy eating. You might start isolating from relationships, excessively cleaning, working, again, policing husband's behavior, excessive exercise, drugs, alcohol, old coping mechanisms, excessive religious behaviors, excessive shopping, blogging, social media, all different kinds of ways really of trying to cope with this fear cycle, which again, remember, goes back to the experience of having trauma. So, understanding that then brings you to a need for healing in your own life. This is where your recovery will be. How do I learn to heal from trauma that I've experienced? How do I learn how to self soothe, reduce that panic, that anxiety? How do I stay out of the fear cycle? How do I do self care, self compassion? How do I take care of myself? And this will often be work you'll do in your group or with your individual therapist in regards to this and anxiety reduction, trauma resolution, things of that nature. If you need help with any of that, we certainly have a fantastic pool of therapists who are trained in both betrayal trauma and sexual addiction. We invite you to make an appointment with one of them if you need to. But hopefully, this quick review is helpful to you. You're not crazy, it's just a very crazy situation.